There is no way that you can walk through the floor of a COVID unit and realize that everybody saw an event that at one point about 70% of them were going to die, that you haven't been changed. Because no matter how long you've been in healthcare, you see a lot of bad things happening, but walking through a COVID unit, the uniqueness of that circumstance, I don't think you're ever going to be exactly the same again. But on the positive note, because I like to be very, very optimistic, what I saw being done during COVID by staff, the integration of our clinical operations, the interdisciplinary nature of healthcare, gives me unbelievable optimism for the future.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Welcome to A&M's What's Your Moonshot podcast. My name is Stuart McLean. I'm a managing director here at Alvarez & Marsal, and I'm here with my co-host, the Honorable Secretary, Dr. David Shulkin. David, it's our great honor to welcome our longtime colleague and healthcare innovator, Michael Dowling, to the podcast. Michael leads Northwell Health. Northwell cares for millions of patients each and every year. It's grown to become among the largest integrated health systems in the country, is the largest in the state of New York. It's an employer, also too among the largest in New York. Northwell today is comprised of 23 hospitals and remarkably 800 plus outpatient facilities, and counts some 76,000 associates as their employees. Apologies. Michael, thanks for joining us today.
Thank you, Stu. It's a pleasure, as always. Thank you so much.
Great. Well, Michael, thanks again for joining us. And, I know that you've been leading Northwell for now 25 years, but probably in some ways, 2020 was a year unlike any of the others. Northwell, I believe, took care of more patients with COVID-19 than any other healthcare system in the United States. You had to double your bed capacity just to handle that. And I think what's so extraordinary is you didn't just get through it, but you've now had a chance to reflect on it, and you crafted a vision for a better future. It's what we call a moonshot. And you wrote a book about it called Leading Through a Pandemic. Now, Michael, I just recently wrote a book, and I know it is not an easy undertaking to do that. So can you just tell us what motivated you to write a book, to be thinking about how health systems can be better in responding to these pandemics, and tell us how it's being received and what it's been like since the book's been out?
Well, thank you, David, and thank you for everything that you have been doing over the years. I really appreciate all of your efforts and your leadership. I never started out to write a book. It was kind of interesting. It evolved because, last year was a year that was unique and nothing like anything else that we've ever experienced, even those of us who've been in the business for 20, 30 and more years. So it was something that was new. And what I was doing every week, because we were at the epicenter of the pandemic, I was taking notes every week. And in the weekend, I would kind of collate the notes and write down some of the learning experiences, the things that were different about what went on. And over the month or two, people suggested that it would be good to write something about this. So basically what the book ended up being is the result of the notes that I was taking on a regular basis. And once I got into writing it and working with, Charles Kenny, who worked with me on this, and then interviewing a lot of the people across the organization, I thought it was going to be very, very important, since this was such a unique experience, that we try to identify the learnings from it and also talk about what actually went on a day-to-day basis each day as we were inundated with COVID patients. We had at one point back in the spring of last year, we had 3,500 COVID patients in our hospitals on a daily basis. We've seen about 220,000 COVID patients in total in the system, both in the ambulatory sites as well as in the inpatient. So it was difficult, but we handled it pretty well. I mean, it tested us, but I think healthcare withstood this pretty well. And I wish that many of the other states had paid attention to the learnings from what happened in New York, because if they had, I don't think many of them would be in the situation that they're in today. Because many did not prepare. I remember talking to health systems around the country back then, and some of them would say to me, well, this is a New York phenomenon, it's not going to happen here. And that's a huge, huge mistake to assume that something like this is not going to travel. But in many ways, and I'll close with this comment at this point, the fact that we went through COVID, as difficult as it was, in many ways was one of the best things that has happened to us, because it demonstrated what you can do in a crisis. Mm-hmm. It helped reimagine the organization, and I think helps in a big way help us plan for what we need to be doing going forward in the future. It was unique, but not the worst thing that has ever happened to people. If you look through history, we have to deal with those crises that hit us. And it's not what happens to you that matters, it's how you respond to it. And I think we responded pretty well.
Michael, as a New York native, and I saw firsthand your leadership, particularly with regard to the massive COVID testing operation that you put up very early. In your book, you describe what the leaders who run health systems are going to have to do to prepare for a new future, a new normal, perhaps. Can you talk a little bit about some of those critical elements?
Well, there's a number of them. One is that we had to deal with the staff morale and the staff security issue in a big, big way during COVID. And we always focus on the needs of staff, but I think we had to do it at an extreme level during COVID. And so it raises the question as to what we should be doing with staff on an ongoing basis going forward, dealing with their security, their sense of meaning, the meaning the work gives them, et cetera, et cetera. That's one thing. The second thing that COVID did was it expanded dramatically telemedicine, virtual care, digital health, or whatever phraseology you want to use. So one of the big strategic issues for us now, and I think it is true of most healthcare systems, is how to prepare for the virtual world that we will all be facing more so in the future now because of the lessons during COVID. Much of our interactions between providers and patients, initial reactions, I think, will be done virtually going forward. It also focuses us to deal with how we manage all the data we've got, how we analyze the data, how we develop information repositories of data, how we analyze it and make use of it for clinical improvement. And the other big issue is that the nature of work has changed. I have 10,000 people today working from home. A year and a half ago, I didn't have people working from home or working remotely. Now I have 10,000. So I've had to reorganize all of our infrastructure, our offices, to accommodate people who will be in a hybrid situation, many of them working at home, coming to work maybe 1 day a week, 2 days a week. And it poses questions about, from a leadership point of view, of how you manage a culture going forward when a substantial portion of your employees will be working remotely, how you handle the culture, the socialization, those things that keep organizations together, kind of the unseen issues that you don't, it's not like infrastructure or other things, it's all of the cultural issues, which to me is very, very key for the success of an organization. And it also gets us to think about the public health infrastructure, because many of the communities were disproportionately affected by COVID, and we've all worked in those communities in the past, but the degree to which we need to work more now going forward was very, very evident as a result of COVID. And that's going to challenge us in a big way. It's going to require us, Stuart, as you know very well, to go upstream more than we've ever done before, and not only be focused on the downstream part of the business, which has been our central focus for all of these decades. And it allows us now to reimagine our organizations, because during COVID, we became more innovative and more creative than we ever were before. We did things overnight that pre-COVID, we would be taking weeks and months to do. So the question now is whether or not we can maintain that level of innovation and creativity post-COVID that we experienced during COVID. So in many ways, COVID was, the pandemic was a kick in the butt. It woke us up. We're all a little bit different because of it. And I'm looking at the good part of what this taught us. Obviously with the understanding of the terrible circumstances that families went through, the deaths and all like that. But from an organizational point of view, you only find out how good you are when you're tested by a crisis like this and what your potential is going forward. And that, I think, is the great overriding lesson. If we're not better in the future because of what just happened to us, then in many ways, I don't think we deserve to be leadership, to be the leaders in organizations like Northwell. It opened our eyes to a lot of things that we partly saw before, but we very clearly saw during COVID.
Michael, the very first thing in the book, in the foreword, you tell a story of a veteran who is suffering from COVID and what it's like to be going through that. And so I just want to thank you for that. You've always had a special place in your heart for veterans. Northwell's done an extraordinary job caring for our veterans. So thank you.
Thank you, David. We have a major commitment to veterans. We hire about 500 veterans a year. We do an awful lot regionally and nationally on veterans. And that's a major commitment.
Yes.
And I think everybody should be committed to the needs of veterans. Every organization should be. You've been taking a lead on this over the years, and we are very, very, very happy to be in the midst of such a wonderful agenda.
Yeah, thanks. The other thing that really struck me in the beginning of your book, you talked about that you've really been preparing for an emergency in this type of crisis management situation since 1998. And so if any organization was going to be prepared, it was probably going to be yours. And you've gone through some major issues in the New York area, of course. But what about, with all that training and preparedness, did this pandemic still catch you by surprise? Were there things that you just couldn't prepare for?
Well, I don't think it caught us by surprise. So we actually started to plan in January, even though we didn't get our first case until March 4th. But as you mentioned, David, we did have a lot of infrastructure that we had invested in over the years. And there's a lesson here that sometimes you invest in things that you don't think have an immediate benefit, but when you look back on it, it has a benefit a decade later. So we have our own supply chain, we have our own lab, we have our own transport mechanisms, etc. We have our own infrastructure. The surprises were twofold, I think. One is we were attacked by an enemy at the beginning that we did not understand at all. We didn't know what it was. We didn't know how it affected the body, or what organs in the body it affected. We didn't know what the treatment were. With a lot of other crises, whether it's a hurricane, you kind of know what's going to happen. Yeah, you can anticipate. I mean, you're going to have trees down, electricity out. You're going to have people without housing. You'll have people without oxygen, maybe out in the communities. So you can prepare. Here, we were preparing for the unknown. We didn't know what this was. The other big lesson and surprise is the longevity of it. Most crises that we've been in over the years, if you have a hurricane or a bad storm like Hurricane Sandy, Hurricane Irene, even 9/11, they come, you get hit with something dramatic. 5 days later, it's almost over. You can see a beginning and an end. With COVID, we still don't see the end completely. So this has been going on for 18 months. So maintaining the urgency among your staff, the dedication and the commitment of staff, the deployment of staff around the clock for a long period of time is a lot more difficult than it is to do something for 5 days. Because you can say, like, suck it up for the next week because it's going to be really bad, but a week from Friday, it'll probably be over. With COVID, we couldn't even tell you, well, is it a year? Is it a year and a half? And we're still today I have 320 COVID patients in our hospital. Now, 90% of them are non-vaccinated. So we have a crisis of the non-vaccinated right now. but we're still in it to some degree, in a small way compared to last year. But those are the two big issues, David, the unknown and the longevity of it. The day-to-day creation of beds, and we didn't have a problem with PPE at Northwell. The staffing issue is probably the most complicated, even though all the press and everybody was talking about ICU beds, the PPE, etc. Those are relatively, in my view, relatively easy compared with the requirement to have competent staff round the clock over a long period of time to take care of a very, very difficult circumstance. The beds are easy. You can create beds any place. And as you know very well, you can create ICU beds if you have vents. Any bed can become an ICU bed if you have a vent. So the availability of vents is the issue, not the potential availability of vents. Those things we solved, those things we did. And we handled it pretty well, I believe, overall.
Michael, you talked about the 5-day hurricane. David, our colleague, has occasionally referred to this crisis as 100 consecutive hurricanes, right? So it just keeps coming; it doesn't stop. So I think that you two see this through a very similar lens. You've mentioned staff a couple of times. You've talked about how much you learned. Kind of the glass is half full. How much we've learned as a function of this crisis. So, with regard to those lessons, how does your vision change for Northwell, and what are those messages that you might share with other system leaders as well?
Well, there's quite a number. One is that you have to plan now to create an emergency infrastructure for dealing with disasters, even though it might not happen for another 5 or 10 years. You got to put your infrastructure together. You have to have the people and the resources. And the danger right now is that people, when it gets to be over, that people will forget and go back and not believe that it might happen again. The second lesson here is that the benefits of integrated large health systems is absolutely key. We would not have been able to handle anything like what we did if we were not a large health system with all the components. We had the ambulatory, the home care, we had we're integrated, we had the research, we had the academics, because we're a huge academic teaching place with 2,000 residents and fellows, all involved, all our medical students are involved. So large health systems and that are integrated are absolutely key to provide the comprehensive range of services you need in the crisis. As a single hospital, you can't do that. It's very, very, very difficult. That's a lesson. The other lesson is that we, as I mentioned at the very beginning, is that we have to focus a lot more on the upstream part of our business, not just only the downstream. We've got to be as good at the prevention and wellness issue, how to get people to change their lifestyle and their behavior. People have a responsibility to do the right thing. We have a responsibility to educate people about how to do the right thing about their own health. That has to become a major focus of large health systems in the future. Of course, the technology angle will be very, very large, and then of course how we manage a workforce that won't be coming to the office all the time, especially the administrative workforce. The hospitals are one thing, but all of the infrastructure that are attendant to back office functions, and that you won't be seeing these people every day of the week. So how you manage that. And I think going forward, organizations have to be optimistic about the possibility of doing good work. Optimism is important. And there's another lesson. I walked the floors of every facility every day during COVID. I was in every COVID unit. I was in a COVID unit each day, all during the crisis. There is nothing to substitute for walking the floors, talking to the staff, making direct face-to-face contact. You can use text, you can use email, which you should, but there is nothing to substitute for staff understanding that leadership is with them in a crisis like this. But it's also important that staff understand that leadership is with them each and every day that we do good work. So my message to leaders and the CEOs is get out of your office, walk the factory floor, talk to your frontline people, understand what they're feeling, understand what their issues are, understand what their concerns are, and you will become a better leader because of it, because you learn from the front lines. And a lot of people didn't do that during COVID, and a lot of people don't do it on a regular basis. But communication cannot be overdone. That's a lesson that to me was very evident during COVID and is a lesson for everybody as we go forward. Don't disconnect from the front lines. Connect with them more. And you build loyalty, you build commitment, you build dedication, and you build sustainability. Those to me are a couple of the major lessons that are very, very important. I think we're all better because of COVID, and we should be better because of it. I think we'll have better health systems as a result of it. And there's one last thing I'll mention. And David, obviously, I assume will, and you, Stuart, will understand it. We were unbelievably able to be innovative during COVID because government relaxed a lot of the stupid regulations that exist. If the regulations had not been relaxed or dispensed with, we would never have been able to do what we did. We were able to create, like I remember one night, we created 200 beds overnight one time. If I had to do that in a regulatory environment that we had pre and that we're now getting back into, unfortunately, it would have taken me months and months and months to do this to get approval. But in a crisis, since I had no regulatory micromanagement, I was able to do it. So there's a lesson here that you need regulation. I'm not against it, but you cannot be put in a straitjacket as an operator that prevents you from being creative. A culture of compliance and regulation is the antithesis of innovation. If you want innovation, you've got to relax the other side to now allow creativity to blossom. Otherwise, you're going to be constrained in a big way. And I fear, given the nature of government these days, both at New York State level and at the federal level, that there is a tendency to overregulate now and have the government take a much bigger micromanagement role, not less. That's an issue for a long discussion at some point, but it is absolutely key to the future of how we can continue to be creative.
Michael, there's no doubt that Northwell benefited from having you at the helm with all of your experience when this crisis happened, and yet you're reflecting on all these amazing points about what leadership needs to do in healthcare and during a crisis. I wonder, how much are you changed by having gone through this, by your reflections, your daily notes and thinking about things? And how much do you think it's going to go back to the way it was? So you talk about leaders need to be visible and walk the floor. You talk about using virtual care and digital care. You talk about thinking about taking care of your staff in a different way. Do you think when people stop dealing with COVID on a daily basis, when your census gets, to a much smaller number, are you going to be a changed leader, or is it going to go back to the way it was?
I don't think it's ever going to go back to exactly the way it was. I don't think it's possible, because I think everybody has been changed by this. I think every organization has been changed, not just healthcare, but every organization in the country has been changed, whether you're real estate or retail or whatever. If you ask, when you ask the question, have I been changed? There is no way that you can walk through the floor of a COVID unit and realize that everybody is so on a bent that at one point about 70% of them are going to die, that you haven't been changed. Because no matter how long you've been in healthcare, you see a lot of bad things happening, but walking through a COVID unit, the uniqueness of that circumstance, I don't think you're ever going to be exactly the same again. But on the positive note, because I like to be very, very optimistic, what I saw being done during COVID by staff, the integration of our clinical operations, the interdisciplinary nature of healthcare, gives me unbelievable optimism for the future. So I am more motivated today than I was before. I'm more excited about the potential. I don't think there is anything that we can't handle if we put our minds to it. You have to give hope. As I've said many times, you've got to give oxygen to hope. So now we live in a very divisive time in our politics. We have excessive partisanship. We're fighting among ourselves on stupid things that we should never be fighting about. During COVID, when you were inside the facilities, we unified. So what we need to do is unify around how it is we improve wellness and health going forward. And I think COVID has changed us to think about that in a more creative way. So yeah, I'm different. You realize the fragility of life. If you think back in January of 2020, we were all strong and healthy. We were looking at our budgets for the year. Everything looked great. We were all, macho. And all of a sudden we get kicked in the butt and we realize that there is a fragility here. We gotta be strong and humble. We gotta be realistic and optimistic. We gotta create the future, not go back to the past. And it's an incremental process. You don't sort of everything upside down all at once. And one last point, we all have to be careful not to be excessively committed to the altar of technology and lose the human element in care delivery. There is a tendency that an app can fix everything. Technology can do all wonders, that you just take your old phone and you press a few buttons here and there and the world will just be beautiful. That's a lot of crap, a lot of crap, I'd say, not crap. Sometimes it would drive you to crack almost.
Right.
So I think we got to, as we think about the future, we got to balance between the use of technology and the human element. Create the hybrid is necessary to maximize technology without ever losing sight of the human factor. That goes for leadership, it goes for frontline workers, it goes for planners, because if we lose the human element, then I think we lose something that we can never ever recover. And that's like a caution for us, because I watch so many people thinking that no matter whatever problem you have, I have an app. Well, the apps are a tool, and the tool might be useful, but put it in perspective.
Michael, thanks. This is a privilege for me to be with both you and David, two significant healthcare leaders. I've known you guys for a couple of decades. And your message today, even as it's post-COVID, is very consistent with the message that you've delivered for years, this focus on humility, humanity, and optimism. And I couldn't agree more, where so much has changed, as you've said, and there's a challenge out there for the regulators and those who govern to allow for that change and to allow for that continued innovation. This is a very positive message. I really appreciate your time, David.
Thank you so much. It's terrific, and we're looking forward to sharing this with other healthcare leaders.
David, thank you so much. Someday let's get together.
Thank you. Great.
Okay, well, thank you guys. Thanks. I appreciate it anytime. Nice to see you, Stuart.
Bye-bye.
Thank you, guys.
Alvarez and Marcel. Leadership, action, results.
Stuart, one of the things that I thought was so remarkable was that even after 25 years of leadership, Michael Dowling is willing to reflect upon what can be better, push the organization to do things differently. And it is this humility that he has, that you noted, that I think makes him such an extraordinary person to want to be part of his type of organization.
Yeah, there's simply no question. And I think what he has built at Northwell, is special. And I think it took, some real innovation and some real leadership to build a system as large as that in a regulatory environment that seems very unfriendly to a system that large. But as a New Yorker, I saw firsthand how powerful that regional integration was in terms of being able to respond really at lightning speed. They put up a massive COVID testing center a couple of miles from my home, quite literally overnight. It was something from, a War of the Worlds movie. They did it with lightning speed, and they couldn't have done it, I don't think, without that powerful leadership and without that, the size and the benefits of that integration. So I think he's emphasized that and how important that is. And that's a real, I think, message for many.
Yeah, I remember very clearly back to those days when the COVID pandemic really started in the New York City region. And I agree with him. People around the country were saying, well, this is going to be a New York phenomenon. This isn't coming to me. And they weren't paying attention to what the New York hospital leaders were doing. But, I used to run a New York City hospital, so I was following it pretty closely. And it was touch and go. I wasn't sure they were going to be able to handle things when they were putting up the tents outside and calling in the, active military to help staff. But, it's extraordinary. No one cared for more patients than Northwell, and they were able to do some pretty incredible things. So I think listening to him talk about that and the lessons you can learn are really, I hope people are paying attention.
Agree. And the other takeaway from me, and that he emphasized time and time again in his remarks, is the importance of the team, of the staff, of the humans, who are here. And every single one of our clients, this, I know this, every single one of our healthcare delivery clients is really struggling with, how to, I love the word he used, provide the security, how to protect, his team, and how to, speak to their morale and their meaning, and while keeping them safe. A long-term problem, it seems to me, without a clear solution, but needs to be at the very front of our collective thinking.
Yeah, I think that's a really good point. He was making the point that some people may emphasize the virtual care or the digital care that's coming out of this pandemic, but that he wants to remind people about the humanity. This was a pandemic that affected people and families, and that it affected the people who cared for them in these institutions in a way that's going to be long lasting. The number of people that are burned out, the number of people that have long lasting behavioral health issues, the number of people that have retired, and it's going to be something that's probably with us for years and years. The other thing which I just wanted to mention, I thought it was pretty interesting for leaders. Sometimes things go so fast and so much is happening, you don't get a chance to sit back and reflect. So he talked about, and he was smart enough to take notes every day. He understood he was going through something, even after 25 years of being a CEO, that was pretty extraordinary. And so he took those notes, and that ultimately ended up writing a book about it. For me, when I was a secretary, I wasn't that smart, but my wife was. And so my wife actually kept a diary. And when I went back to write a book, I used her notes in the diary. So I just thought it was an interesting thing for leaders to think about. Maybe take 10 minutes at the end of the day and make some notes about what you learned, what you saw, what you're struggling with. And I think it's a good technique.
Yeah, it's well said. That the power of reflection and how important that is for the benefit of others.